Good afternoon, everyone. Welcome to CIPHI Ontario Seminar Series. My name is Eric Devine. I'm the Communications Counselor for CIPHI Ontario. I'd like to welcome all those people on the line. We do have a few people here in the room as well at 661 University, the Dr. Donald Low Emergency Operations Center. It's a nice view over the western side of the city. You can see pretty much to the escarpment, nice clear day. Thanks everyone for joining us. For all those people on the line, we will remain in lecture mode for the duration of this call. If you have any questions, please send them through the chat pod located at the bottom right of your screen. You can get questions in as they come to you throughout the presentation, or we can load them all up at the end. We will have some time for Q&A after the presentation. And would like to ask those people online to please indicate how many people are in the room with you, just so that we can track numbers. And we would like to thank Public Health Ontario for co-hosting this event with CIPHI Ontario. Today's speaker is Beatrice Povolo. She's the Director, Advocacy and Media Relations for Food Allergy Canada, which is formerly Anaphylaxis Canada. Beatrice is responsible for the overall development and management of key strategic programs offered by Food Allergy Canada. These programs include the Corporate Sponsor Program, Consumer Advocacy Initiatives, and Media Relations. She has been the project lead on many allergy-related issues within the community, such as food labeling, airline travel, food service training, and post-secondary allergen management. Beatrice joined Food Allergy Canada in 2007, and prior to this position, she was the Director of Marketing and Product Development with Manulife Financial in Toronto. She also held various managerial positions over a 10-year period in the financial sector with TD Canada Trust. Beatrice first started as a volunteer with the Food Allergy Canada in 2005 as the chair of Toronto Anaphylaxis Education Group when her son was diagnosed with a peanut allergy, and as such understands the issues facing both those individuals at risk as well as the overall allergy community. Beatrice graduated from the University of Toronto with an honors Bachelor of Arts degree in Political Science and Economics. And at this time, I'd like to welcome Beatrice, and we look forward to your talk. Thank you.
All right. Terrific. Thank you so much. I'm very happy to be here on behalf of Food Allergy Canada, speaking to all of you today. So as we start off the presentation, I just wanted to get into a little bit of the agenda, what we'll be covering off today. There are a couple of things that we want to focus on as part of this presentation today. First and foremost, we want to do an update in terms of adverse reactions to foods, everything from intolerance, food allergy, and anaphylaxis, as a refresher for those of you familiar with food allergy. We also like to talk a little bit about the dining out experience and really what it means to dine out with a food allergy from the consumer perspective, but also look at some of the challenges that are within the restaurant and food service sector as well, and really looking at this opportunity as a shared responsibility when it comes to dining out for individuals with food allergies. Following that, we'd like to present some common practices that we've seen that can be quite effective in managing food allergies from a risk management perspective in food service establishments and restaurants in Ontario and quite broadly across the country. And finally, just to wrap up in terms of some of the recent changes that were part of the modernization of the Guide for Ontario Food Handlers, which is of course here in Ontario that was put up by the ministry early this week, and some of the key highlights that we were able to help with in terms of that particular document. And as Eric mentioned, we'll have an open Q&A at the end, so please take notes as we go through and write down any questions. Be happy to address them at the end of the session. Okay. So for those of you who aren't familiar with Food Allergy Canada, just a quick overview of our organization. We are a national not-for-profit group established back in 2001. Our emphasis and our mission continues to be on focused individuals and families, helping to support individuals and families with food allergies right across the country. We talk about being driven by passion. We are a small group, mainly based here in Toronto, with a Western Region office in BC as well. But really, we do a lot with very little. We are very passionate about what we do, and it really comes through in some of the initiatives that we've undertaken over the years. For example, here in Ontario, we were the first province worldwide to have a law to protect children at risk of anaphylaxis in schools, known as Sabrina's Law, that was put into place in 2005. In addition, we have lobbied and worked with Health Canada and the CIPHI for over a 10-year period for enhanced food labeling that came into effect in 2012, which basically allows individuals with food allergies to be able to identify common allergens on prepackaged goods in very plain, simple language. And this has been a huge win and a huge opportunity for this community to be able, again, to identify what's in their food and, of course, to avoid it if they have allergies to that. Overall, our mantra is to be careful and not fearful. We try to provide a very balanced voice throughout the community when we're dealing with a number of issues, so whether it's food service related, dining out, school policies, etc. We really look to see what we can do from a balanced perspective in terms of being able to manage allergies in a beneficial way to help those that are at risk as well as the greater community. So we aim in general for very reasonable solutions and again work collaboratively with many groups to ensure that we can achieve that. In terms of some of the products and services that we offer, just a quick glimpse into some of the things that we work on. We've worked in the past, for example, with Restaurants Canada. We created a guide for food allergies, as you see on the right-hand side of the screen, that is available to all their members in restaurants across the country. That gives an overview of what restaurants can do to help manage food allergies in their establishments. We communicate regularly with our membership through our allergy information service, our newsletter. We've also worked with one of Canada's leading safety training organizations known as TrainCan on development of an allergen training course for, again, available across the country for anyone within the food service or retail industry. We also help to provide resources and education for the community, specifically through our Allergy Aware course, which is a free course available to anyone who is interested in learning more about food allergies and anaphylaxis, whether it's in a school setting, daycares, or just in general in the community. So to start in, what we'd like to do is do a quick overview of adverse reactions to foods and the different types that you may see or that restaurants and food service may encounter. As you'll see in this particular diagram, we'll look at intolerance, food allergy, and anaphylaxis. And these are some of the most common adverse reactions that individuals can have. The key thing for all of these specific conditions is that individuals must avoid what they're allergic to in order to stay healthy and safe. So we look at intolerances. One of the most common ones is a gluten intolerance or celiac disease, which basically is an abnormal immune reaction to gluten, a protein found in wheat, barley, rye, and possibly other oats due to cross-contact. When we look at symptoms for individuals that suffer from celiac disease, they can be quite mild or they can be severe, but thankfully they don't have an immediate life-threatening reaction as you would with food allergy or the potential for anaphylaxis. So here are just some of the common signs and symptoms that individuals that suffer from celiac can experience. And if they do inadvertently consume gluten products, these are some of the things that they could feel or some of the symptoms they could experience. It's estimated that in Canada, about 1 in 133 people have celiac or affected by gluten intolerance. So this is an emerging issue and one we know that the food service sector does take quite seriously and does look to accommodate with various menu options. In terms of food allergy and anaphylaxis, when we talk about food allergy, it really is an abnormal reaction to common foods. The severity of the symptoms can range from mild to severe, with the most severe reaction, which can be life-threatening, known as anaphylaxis. Food allergy in general in Canada, it affects 1 in 13, or about 2.5 million Canadians. This number, unfortunately, is one that seems to be increasing in terms of the people affected by food allergy across the country. We know that about 1 in 2 people know someone with a food allergy, so this is something that more and more people are becoming aware of. In Canada, we have just over 300,000 children that are affected by food allergy, and unfortunately, new diagnoses are happening every day, every year. So this is a growing public health concern right across the country. So when we talk about anaphylaxis or severe allergic reactions, we'd like to just go over, for the next few minutes, some of the common signs and symptoms, the emergency treatment that's needed when it comes to managing this condition. So again, talking about anaphylaxis, it is the most severe type of an allergic reaction. It can affect a number of different body parts. It can happen very quickly, and as I mentioned before, it can be life-threatening. So immediate treatment is necessary. In terms of some of the signs, some of the common signs and symptoms that you may see, they can vary. They can vary from person to person. They can even vary from one reaction to the other in the same individual. So this is a quick list, and our acronym is Think Fast. FAST standing for face, airway, stomach, and total body. And again, looking at some of the common signs and symptoms such as hives, trouble breathing, there could be stomach pain, there could be itching, swellingness, etc. So there's a number of different things that that an individual can feel or can experience as a result of a severe allergic reaction. What's really important to note is that the most dangerous symptoms of any allergic reaction are difficulty breathing or a sudden drop in blood pressure. These are the two components that can lead to a life-threatening situation. In terms of what some of these symptoms can look like, so in this particular situation, this is a young child that experienced an anaphylactic reaction. As you can see, he does have hives on his body as well as on his face. There is swelling in around his eyes, nose, and mouth, but it is important to understand that hives are not always present when it comes to a severe allergic reaction. And in fact, some cases, there were no hives. So I know a lot of individuals look for the redness or the hives when there is a reaction or they think there's a reaction, but just to note that it's not always present. It can be one of the common symptoms, but does not have to be there. So really looking for some issues in terms of breathing difficulties. Again, as I said, drop in blood pressure. Those are very important symptoms that should never be ignored. In terms of the food, when we talk about food allergies, what are the common foods that really cause the majority of reactions? So Health Canada has identified the following priority or common allergens that are responsible for up to 90% of allergic reactions. So everything from peanuts to tree nuts, milk, egg, etc. These are the ones from a labeling perspective that Health Canada has called out and must be accurately indicated on a food label if they're used in prepackaged goods. In addition to that, sulfites, which is a food additive, is also part of the priority allergen list that has to be identified on a food label as well. When we look at the different types of food allergies, some are considered to be more lifelong than others. So peanut, tree nut, shellfish are usually or tend to be lifelong and are not usually outgrown, whether in children or in adults. Other allergies such as milk and egg, thankfully in many cases, up to 80% of them are usually resolved by school age or a little bit later. But that still is 20% that do continue to have those specific allergies, but the good news is that the majority can outgrow those. It's also important to note that you can develop a food allergy at any age. We do hear of children, of course, upon exposure as young people, they can develop allergy, but we're also hearing about adult onset and individuals who have been safely eating, shellfish or peanuts for years, all of a sudden do develop an allergy. So unfortunately, it can be quite unpredictable. It can come on quite suddenly, and it's something that people need to be prepared for. When we talk about emergency treatment, it's really important to understand that the first line defense for any serious allergic reaction or anaphylaxis is epinephrine. Currently in Canada, there is only one device available to individuals who have food allergies or other serious allergies for treatment, and that is the EpiPen. So just a quick visual here of what that device looks like. I'm sure many of you have probably seen it over the years. The medication in an EpiPen is, as I said, is epinephrine or adrenaline, and it reverses the symptoms of a severe allergic reaction. In all cases, when an EpiPen is administered, the individual should go to hospital, preferably by ambulance, to be observed by a medical professional. There are situations when an individual can have a secondary or a biphasic reaction after the fact, and they should be in medical care. In terms of the safety of use, and I know there's lots of conversations happening now, I think, in media and otherwise in terms of epinephrine and the safety of having EpiPens, for example. So according to the Canadian Society of Allergy and Clinical Immunology, which is our peak body or our national body of allergists in Canada, epinephrine, again, there's no contraindications for normally healthy people in terms of safety of use. So our recommendation is that if it is a suspected reaction, whether it's a child or an adult, and you think they may be having a reaction, epinephrine would be the first line defense. In terms of fatalities from anaphylaxis, the good news is that they are rare and they are preventable. In a study that was published in 2012, it was a retrospective that looked at 92 Ontario deaths between 1986 and 2011. Some of the highlights from the study showed that 44% of those individuals that passed away was as a result of a food allergy or involved food, and 14% of those reactions happened in restaurants or other food service establishments. When we looked at some of the common risk factors in these specific cases, a few things came to light. For example, the prompt or use of epinephrine, the use of epinephrine, for example, was not done perhaps in a prompt or timely manner. The individuals did have a history of allergic reactions or past reactions. In some cases, there was a cofactor of asthma, which was not properly controlled, which could have contributed to the severity of the reaction. There was accidental exposure to hidden allergens, so it wasn't someone didn't necessarily knowingly eat a food that they knew they were allergic to. It perhaps was hidden in a food or they weren't aware of it. And unfortunately, from an age perspective, we do see our teens and young adults as the most at risk, unfortunately, in this scenario. I'd like to move on now to look at the dining out experience. Now that we've kind of looked at, what is anaphylaxis, food allergy, and intolerance, just to get a sense of what that looks like and how common it is across the board. When we talk about dining out, whether it's in Ontario or across the board, we generally look at this from the allergic consumer perspective as a shared responsibility. The reality for someone that lives with a food allergy is that there is no cure, and the main way to stay safe is constant vigilance and avoiding what you're allergic to. May sound quite simplistic, but really at the end, that is what individuals have to do. But it's not always a simple process, and it can get quite complex. Unfortunately, we don't know how much of a food, for example, could trigger an allergic reaction in different individuals. We know that even a small amount can definitely do that, but that could vary between individuals as well. We don't know who's at risk for a mild, a moderate, or a fatal reaction. Currently, there's no specific testing that are available to allergic individuals that would say that you would have a mild reaction or a severe reaction. So individuals have to be prepared for the worst case scenario, that they could be an anaphylactic reaction, so they need to be prepared. Some people, as we mentioned, will have food allergies for life. They will not necessarily outgrow them. And unfortunately, accidents do happen despite people's best efforts. So what does it mean to be constantly vigilant and to avoid? So as an individual or a parent of a child with someone with food allergies, there's a few things you're constantly doing. One, always reading food labels. So for all foods that are purchased and prepackaged, you need to know what's in that food, so you're reading those labels to make sure that it does not have the allergen you're allergic to. You're always asking what's in the food. And so what that means from a food service perspective is asking for ingredients, how things are prepared, issues of cross-contamination. There's this whole series of questions in order to determine, again, would that be a safe option for myself or my child. And finally, always carrying your epinephrine auto-injector, such as an EpiPen. So these are just some of the key things that people have to consider when they have a food allergy. The concept of shared responsibility is something that we take very seriously and that we feel is very important. So at the center of the I guess, responsibility matrix is individuals and families. So those that are affected by food allergies are ultimately responsible for managing their condition and trying to stay safe and avoid what they're allergic to. But as you can see, there's an entire support system that's needed there in order to help those individuals. Everything from the medical community, from a diagnosis and treatment perspective, to if children are in schools or other daycare settings, you're depending on those individuals to watch them during the day, so there needs to be a level of education there on food allergies. Government, public health, food service, etc. Everyone has a role to play. And at the end of the day, we're looking to collaborate with all these different groups so that we can keep individuals with food allergies safe. As you all know, in Canada, we currently don't have any specific regulations or legislations around managing food allergies in food service or in restaurant setting. There was a ruling back in 2011 in Saskatchewan that did establish what's known as a duty of care. And I'm not sure if everyone's familiar with this specific case, but very quickly, there was an incident that occurred at a hotel with with an American visitor here to Canada. Unfortunately, he had ordered a dessert. He had informed the waitress of his nut allergy and asked if it would be a safe option. She responded, yes, it's fine. He consumed the product and unfortunately had a very severe allergic reaction and ended up in hospital. As a result of that, this individual decided to take the case to the Saskatchewan court, and in the end, the ruling was that it established what's known as a duty of care for restaurants that says if an individual is disclosing an allergy to you, you have the responsibility to provide them with the information they need, whether it's ingredients, preparation, etc., so they can decide whether that's a suitable option. Unfortunately, in this specific case, it was deemed that the waitress did not consult with the kitchen or the staff and actually did not read the box in which the dessert came, because it was a fully labeled product, and unfortunately it did have nuts as one of the ingredients. So in terms of looking from a broader perspective across the country, this concept of duty of care has been established, and it is something that we look at when we look at what would be appropriate for food service or restaurants. In terms of consumers, so what I'd like to do is kind of look at from the consumer perspective of managing food allergies when dining out or in restaurants, and then look from the restaurant perspective as well. So for consumers, as I mentioned, there's some key rules. Very simple, as I said, but not always easy to manage. First, ask before you eat, regardless of if someone else is creating or making a meal for you, whether it's, sometimes could just be grandma and grandpa, or it could be dining out. You want to know what's in your food, so you ask before you eat. You read the label every time on every product that you purchase. You always carry your auto-injector, whether you're 4 years old like Joseph is in this picture, or you're 90 years old. You want to make sure you're always carrying your auto-injector and have some sort of medical identification, such as medical alert, in case you're not able to disclose that. So these are just some very common things that people do on a day-to-day basis. In terms of the role of the consumers when dining out, again, a lot of the responsibility is on the consumer to ensure that they are informed and they have the information they need. So what we recommend is always being able to plan ahead. So for example, that might mean checking the website of a restaurant you'd like to go to see if they have their menu, ingredient list, and allergy policy posted, so you can inform yourself of what you can expect at that establishment. We always recommend to call ahead. On off-peak hours, when you can have an opportunity to speak to a manager or chef specifically about different menu options, whether it's ingredients or meal prep, because again, that's what you need to feel comfortable with in order to proceed. And always tell others about your allergens. So if you're dining with individuals, you're dining with family, friends, or others, letting people know that you do have an allergy and where your auto-injector is really important. When you get to the restaurant, it's also important to disclose. So you're going to be talking to your server and ideally to the chef and manager, again, about your allergies to determine what menu option might be appropriate for you. And that conversation, again, will include information and asking about ingredients, food preparation, possible cross-contamination, etc. And finally, always being prepared, as we talked about, carrying your auto-injector and know how to use it at all times. In terms of the staff and management at different restaurants and food service establishments, again, when we talk about shared responsibility, we also feel there's a role that they need to play as well. And we've kind of broken it down into two sections. So when we talk about restaurant staff, we feel it's very important for there to be a general understanding of the seriousness of food allergies, understanding that they can be life-threatening, that if an individual does disclose they have a food allergy, that that's not just something that says, oh, don't really like that, or it's, it's a preference, that this needs to be taken seriously and that it has to kind of trigger the right response and protocol within the establishment. We think it's important for all staff to be trained on allergen management policies and procedures that have been developed within that establishment, because everyone has a role to play there as well. And from a very basic perspective, ensuring that individuals have a point person or can refer any allergy request directly to a senior person, such as a chef or manager, so they can speak directly to the diner. That sense of communication is very important. Once that's disclosed, the chef and manager will look at suggesting safe options where appropriate or where possible, based on the information that they receive from the diner with food allergies. They will then inform the kitchen and the staffers in terms of the order, and ideally be able to reconfirm that order before it's served. So there is a whole cycle of communication and information that we feel is really important that needs to take place in those environments. But we do know that currently there are gaps in the system, both from the consumer side as well as from the restaurant side. And this is something that we would like to address as a community and look for reasonable responses that can help to minimize some of these risks for consumers. So what I thought I'd share with you today is just some recent information in terms of some surveys that have been done both in Canada and the U.S. that do highlight some of the gaps that we have right now within this environment. So Food Allergy Canada recently did a survey, just over 1,400 participants, looking at some of their attitudes and behaviors when dining out. So one of the questions we asked is, have you had an allergic reaction in a restaurant over the last 2 years? 12%, or approximately 169 consumers, said yes, they had. Of those individuals, 73% had told their staff prior to ordering about their food allergy, and 16% had not. So this shows, from a gap perspective, we would like to see that number of disclosure at 100%. And I think ideally everyone would like to see that. But unfortunately, in some situations they felt they didn't need to disclose, or they had specific reasons, which I'll get into in just a second. On the other side, there was a recent U.S. survey done on food service that had just over 270 participants. And there's some key findings in that as well, which was quite interesting. So a couple of things that we found, again, from a gap perspective, is of those individuals, 12%, or almost 1 in 10, that includes managers, food service workers, as well as servers, thought that an individual with a food allergy could still consume safely a small amount of what they're allergic to. So that's quite concerning. That's about 1 in 10 individuals. In addition to that, only about half the restaurants had a person on duty at all times to handle food allergy requests or information. So these, again, from a communication perspective, from a training perspective, these are concerns, I think, for individuals with food allergies and the level of knowledge in food service establishments. The good news in terms of some of the results that came out of the food service survey is that over 90% of those that were surveyed did recognize that it's not okay to just take off an allergen from a prepared meal. So for example, let's say you had a cheesecake that had walnuts on top and someone said, I'm allergic to nuts. They knew it was not just okay to take those away and then serve it. So that's a good thing. But again, the flip side is 10% didn't necessarily have that understanding. So again, there's some gaps in knowledge, but understanding that the majority of people did understand that is definitely a positive sign. When we dug a little deeper into some of the consumer elements in terms of why people had disclosed or who they disclosed to or did not, that did have a reaction in the restaurant, here's the findings. So for those individuals, again, that did experience a reaction and did disclose, 85% of them spoke to the server, so the majority are talking to their wait staff. 37% spoke directly to the chef or manager, and 25% had called in advance in terms of notification. So for those individuals that did not disclose, the 16% that we had mentioned on the previous slide, we asked them why. Why did you feel that you didn't need to disclose that information? So the top reasons were that they had ordered the same menu option in the past and I guess assumed that it was okay. They had read the menu and felt that it was a safe option, so just by the way it was described, they felt a sense of comfort. And finally, some of them were just not aware of their allergens, so they weren't aware that they were allergic to that specific menu item. In addition, when we looked a little further into emergency treatment and were people prepared just in case they had a reaction, so 94% of the respondents did have an EpiPen, which is great. Again, we'd like to see that at 100%. But of those that did, 86% always carried it when they were dining out. So again, we would like to see that number increase as well, and individuals continue to have emergency medication if needed. So again, I think both of these studies really kind of highlight that, again, there's responsibilities on both sides. We still have a ways to go in terms of some training and education on both the restaurant side as well as on the consumer side. We did ask consumers what would make you feel comfortable. So when you're selecting a restaurant, when you're dining out, what makes you feel comfortable in knowing what they have in terms of information for you. So these are the following things that kind of came up in our survey. So having an allergy policy and procedures that they can either review or talk to someone about was very important. Being able to review ingredient lists or manuals. Knowing that there's some form of restaurant training, so whether it's regulations around having someone trained in a restaurant that knows about food allergy was important. The ability to speak directly with the chef or manager, again, about their concerns or about their questions, and where there were options on the menu that were considered allergy friendly. Overall, about 70% of individuals specifically select a restaurant based on their allergy policy or availability of ingredient information. So this is very, very important to the majority of people that are affected by food allergy. And again, it goes back to understanding what's in your food. So having said that, what are some of the common practices that we are seeing that are being quite effective in the food service industry and that we would like to share and see that even broader across the board? So in terms of an approach to allergen management, this is something we had put together again with Restaurants Canada a few years ago as part of their allergy guide in looking at some things that people in the food service industry should consider when they're developing a program or developing a policy. So step one, or the first off, it goes back to the awareness of the seriousness of food allergies, ensuring that all staff, so whether it's front of house or back of house, are aware of the seriousness of food allergies and how they can help within their role to minimize the risk to consumers. We also want to be able to provide staff with access, again, to the information they need to be able to convey that appropriately to consumers, including ingredient and meal preparation information. Being able to identify the risks, such as cross-contamination, for example, in both front of house and back of house is very important, and establishing a clear documented policy for staff to follow. So similar to other policies that would be available or would be appropriate for these environments, I think it's very important to have some sort of documentation that people can read and review and can be updated as needed on a regular basis. Informing and training staff, again, is very key in any management plan. And the effective communication within the consumer base is critical in this situation. And finally, looking at developing an emergency plan. So what will happen or what can happen in the event of an emergency if someone's having an allergic reaction? What is the emergency plan? Who is contacted? Who calls 911? Is there an option to help that individual for treatment within the establishment? So that goes a long way in developing a holistic way to manage allergens in the food service industry. In terms of communication, again, we really wanted to reiterate this, and we thought we'd just do a quick visual in terms of why it's so important for all communication when it comes to allergen management to begin and end with the allergic consumer. So we kind of follow through this schematic. What the key focus here is the individual consumer, again, is responsible for disclosing to the host, to the server, that might be their first point of contact. Next, in terms of the communication chain, all that information should be relayed directly by the consumer or the server to the manager or chef. They then at that point should be working directly with the allergic consumer, again, as we talked about, trying to find what options might be available and might be appropriate. Taking that back again to the chef or manager, who then relays that information to the kitchen staff, back to the chef or manager, back to the server, back to the allergic consumer. It seems quite an involved process, but really at the end, the concept is to develop a process where everything again starts and ends with the allergic consumer, so that the risks are minimized throughout the process and a safe option can be delivered to that individual. So finally, we just wanted to touch on some of the recent changes that you may be aware of that have come from the Ontario Ministry of Health and Long-Term Care in regards to an update to their guide for Ontario food handlers. Earlier this week, there was communication sent out with an updated version of the manual. We were very happy to work with the ministry on some of the updates specifically to the section on food allergies. Some of the highlights, we won't get into all the detail, but some of the highlights that were updated were things like prevalence information. As we mentioned, over 2.5 million people in Canada are affected by food allergy. Signs and symptoms of a reaction, so similar to what we discussed earlier, just highlighting some of the key symptoms to look for and understand in terms of seriousness of reactions. The need for immediate emergency treatment, as we mentioned. Updating the list of common allergens, which now, as many of you know, include mustard, which was updated in the 2012 update with Health Canada, and looking at enhanced communications opportunities for being able to disclose this information to participants. In terms of kind of next steps or call to action, what we would love to see in working with Ontario Public Health is that based on the changes that have now been made to the Food Handlers Guide, that all health units take a look at that and be able to update their own materials that they're using within their units. Continue to reinforce the need for proper allergen management in food service and restaurant operations as you're out in the field and interacting with this very important industry. Helping to continue to inform restaurants and other training providers on the content updates. And we're here to help. So Food Allergy Canada is happy to be a resource for any of the units or public health inspectors out there. I put my email up there, and we can definitely have that distributed through Penny in the group here if you're not able to take that down right now. But just understanding that as an organization that's really dedicated to helping individuals with food allergies live well and be safe, we're always open to working with industry and with public health on this important issue. As I mentioned before, we do have a resource that is available, again, across the country, both online and in print, in terms of an allergen management guide that we put together with trade hands. And I just want to leave you with this one last slide. We had this poster put together a few years ago, and I think it really kind of talks of the essence from a consumer perspective in terms of people with food allergies give thanks after a meal. It's really important that, again, they get the information they need to make an informed choice, and by working together with industry and government, we feel that we can definitely make a difference and help keep allergic consumers safe. So with that, I am going to end the formal presentation and open up the Q&A and pass it back over to Eric. Thank you.
Thanks, Beatrice. We're just going to change a couple of things here technically so people in the room can see what's going on with the chat pod. Since people online, just give us a moment, please. Okay. Thanks, Beatrice. Really appreciate your presentation. We've got a few people here in the room. I'm going to give some people a few moments to phrase some of their questions. We'll alternate between the room and online, but I'll take this opportunity to throw in a few comments as well. That one of the things I found very interesting is that you're talking about the first line of prevention for exposures, and I would like to remind those people out there that health inspectors play a critical role in this prevention of exposures as well by, pardon me, helping to educate and monitor food handling and food premises through good hand hygiene, access to good hand hygiene. We often see as inspectors that even when hand hygiene sinks are available, if they're blocked by material and staff can't get to them, this is a real barrier to practicing good hand hygiene. We also look at preventing cross-contamination through good food storage practices, good food handling practices. So while you talk about the first line of defense being, in food premises being education for families to ask managers, to ask to speak to chefs, behind-the-scenes inspectors also help with this before the family even arrives. And this is the preventive nature of what public health inspectors do. And it reminds me of a story when I was working many years ago and as a younger man and much thinner, that as a server, I always remember this couple that came in, this older gentleman said, I have to decide whether or not I want to kiss my wife tonight because she has a shellfish allergy, and that will determine whether or not I order the lobster. And that always stuck with me, that story that, some people do have these very sensitivities where this guy had to decide whether or not, like if he had a little bit of residue on his lips, can't kiss my wife tonight. So it is a very serious issue, and that always just kind of stuck with me. It also strikes me that the role of the public health inspector, while substantial, is still interrelated with owners and operators of food premises, and it goes from all of the staff in there, whether or not it's the person that's bussing tables, whether or not it's the chef, whether or not it's the manager. The education spans the entire spectrum, so that when we're in there doing our inspections, the education is not just at the managerial level or the supervisor, it's with all of the staff that are there. So the inspectors can play an important role in helping prevent these exposures. Just scrolling, can I scroll here, Penny? Yeah. Just taking a look at the online chat box, please enter your questions there if you have them. And I would remind all of those people on the line, just for tracking purposes, if you could let us know how many people are in the room with you, just to we get a better understanding of how many people are attending the sessions. Are there any questions in the room? Questions or comments? Okay. Online, it looks like some people are phrasing lots of congratulations and thanks for an interesting presentation.
From the room, can we ask if the odor will cause reactions for an individual?
Sorry, let me just check here with Penny. Penny, are the room mics on?
Yeah.
Yeah. Okay, so the room mics are on. You can phrase your question then again.
The question from the room would be, if odor alone can trigger a reaction in the food service facility.
Thank you for your question. There's Beatrice here. So the question, just to rephrase, is can an odor of a food cause an allergic reaction? So the answer to that is no. Simply smelling or an odor of a specific food, so peanuts, for example, individuals have been known to say that just the smell of peanuts can cause a reaction. That is actually not true. It's a protein in a food that causes an allergic reaction. So if that protein of the food is ingested in any way, so through eating, for example, or exposure where it can be ingested, it can cause an allergic reaction. However, just the smell of a food will not.
Thank you. Another question in the room?
So I just a little comment and question. I really appreciate I thought your presentation was excellent, and I really appreciate the top 10 allergens and the anaphylactic risk with them. What I'm kind of edging on here is that what happens if your allergy is not within one of those top 10, and is there emphasis also placed on the fact that, yes, these are the top 10, but we also have to be aware of the fact that there are less common ones that can be just as serious, and what your experience is with that?
Great question. Thank you. So just to reiterate, the question is, other than the top 10 that were mentioned or identified by Health Canada, understand that there are other foods that could cause reactions as well. So absolutely, I think it's an excellent comment. Individuals can be allergic to any other foods as well. As mentioned, the ones that were indicated there are the ones that have been known to cause up to 90% of food allergic reactions. And from a labeling perspective, Health Canada has identified them as the most common and needing to be identified on packaging. However, consumers can be allergic to other things. So whether it's strawberries or kiwi or other types of things, those can be common for individuals. It is important to understand that if they have been diagnosed with that allergy, they can also experience similar severe allergic reaction and potential anaphylaxis, because that is what their body is allergic to. So understanding that yes, there are more common ones, but even the less common ones need to be taken seriously and addressed, because they can also cause severe reactions as well.
I'd like to, again, pose another question of my own, because I was struck by the numbers that you were saying, that about 2 million Canadians, and of that about 300,000 children. We hear anecdotally that there seems to be more allergies in children. Is there any evidence to support that, or is this just a function of better media coverage?
No. Thank you for that question. So in Canada, we've only had one prevalence study that has been conducted in Canada. There actually is some data hopefully coming out later this year. And that specific one was done looking at, again, both prevalence in adults and children. So the numbers that we have are specifically from that. So unfortunately, we don't have a specific additional study as of yet, but it is coming to compare whether or not there's been a rise or not in terms of food allergy. But to your point, Eric, I mean, we do understand that it is a growing public health issue. That there are, we are hearing, as you mentioned, both from parents, patients, doctors, etc., that children, especially as they're being diagnosed at earlier ages, we are hearing more about food allergy. So although we don't have specific statistics around the prevalence and the amount of change, we're definitely hearing more about it. And as I said, it continues to be a growing health issue right across the country.
Yeah, one of the things that I also found surprising in your numbers was that the exposures in food premises was relatively low, and I have some questions about how that survey is conducted and how that data is gathered. But Rachel MacArthur has an interesting question that may be related to that as well, that how we prevent those in food premises is that you spoke about allergy training for restaurants staff, but is this mandatory, and if so, how is that done? I know that you spoke about some involvement with TrainCan. If you could maybe expand on that a little bit, your involvement there.
Absolutely. So to answer Rachel's question, currently in Ontario and right across the country, food allergen training management is not mandated for restaurants or food service. This is being done on a voluntary basis. Some restaurants and food service do have programs in place, and some do not. One of the things we would like to see right across the board is to have some form of common standard for universal training for all staff staff in restaurants. And I think just, again, through some of the information we looked at today, we feel that it is very important, and I think the staff themselves feel that it's very important as well. So unfortunately, from a mandatory perspective, there is nothing mandatory. There are a number of different training opportunities out there. So as I mentioned, we've developed a course with TrainCan that looks at allergen training for food service staff at the frontline level, as well as, again, for various levels within the restaurant. So that's one option. I understand through the ministry there are other options as well. I think as an organization, what we'd love to see is, again, looking at training, common practices for training right across the board, and to ensure that people are well aware of the risks involved in food service.
Simcoe Muskoka District Health Unit has a follow-up question to whether or not smell or odor can cause an allergic reaction. And they're saying they have colleagues who are allergic to peppers or other spices that due to smell. And I was actually curious about that myself. I remember for those that graduated around when I went to school at Ryerson for the training, we had a colleague that was allergic to oranges. So when that time of year when clementines came out, we were asked to just kind of restrict that, and it was one of those things where they could trigger a reaction from a distal location. So you just comment on whether or not smell or odor.
No, absolutely. Thank you. So again, so just to reiterate, the smell only of any specific food that you could be allergic to does not trigger an allergic or severe allergic reaction. In the specific allergen or food, there must be a form of ingestion to actually get into the bloodstream, into the system, in order to cause a reaction, because it's the protein of the food that causes the reaction, not the smell.
Thanks for clarifying. Appreciate that.
Is it possible to talk about airborne allergens triggering reactions as well?
Sorry, so there's just a question in terms of airborne allergens. So airborne is, again, different from smell. So there could be a situation, for example, if you have sizzling fish that you might be cooking, for example, where there could be some proteins that are released immediately into the air in that specific area. That could be a cause for concern. But again, very different from the odor of a specific food.
Any other questions in the room? I'll just give another moment for any lingering questions to come in through the chat box. While that's happening, I'll take some time to do a few housekeeping things that I'd like to welcome everyone to our next CIPHI Ontario seminar series, which is going to be held on June 14th. Ken Diplock will be presenting about food safety in Ontario youth, and remind people out there that the CIPHI Ontario Fall Conference and Annual General Meeting is going to be happening in Peel Region this year, and I'm not certain if abstracts are still open for submission, but would consider those, would remind most people on the line or in the room, this was a very interesting presentation that we might be able to put to a wider audience. So please visit the CIPHI Ontario website or the Peel Region Annual Education Conference website to consider submitting an abstract. Or if you want to become a vendor, we always appreciate those as well. And of course, if you're not considering to be an attendee, please reconsider and joining us at that conference. There do not seem to be any more questions on the line, so at this time I'd like to end the seminar and thank all of those for participating here in the room, and for those people online participating, and would urge you, our colleagues out there, to consider visiting us. And sorry, there was one last lingering question. This one always comes up, is whether or not the presentation will be shared. And I will remind all of those out there that all of the presentations are recorded by audio, and the slide deck movement is recorded, so that you can visit the CIPHI Ontario website or view on the YouTube, the CIPHI Ontario YouTube channel, usually posted within a couple of days. And always appreciate your comments. And again, my thanks to Public Health Ontario for helping organize and